After years of rising insulin prices, a growing number of diabetics and their families are now facing some tough choices when it comes to paying for the drug. Some are turning to the black market to buy illegal insulin.
So many people are dying because they just can't afford their insulin.
Doreen Rudolph says she's doing everything she can to make sure that doesn't happen to her 27-year-old daughter, Nicole, a type 1 diabetic.
How's your work day?
When her daughter was first diagnosed, Rudolph says a vial of insulin cost about $21.
And then it went up to like $31, $45, $200, and then $400 a vial.
Even with insurance, Nicole now pays $1,300 every 3 months out of pocket.
You pay or you die.
A recent study from Yale found that 1 in 4 patients actually put themselves at risk by rationing their insulin in order to try to offset the cost. Well, CBS 2 found others are turning to a growing black market.
I'm calling because I saw your ad
where they buy the drug at a fraction of the price.
So $200 for 2 boxes and then the extra. Okay, cool.
Producer John Diaz easily found insulin for sale online, posted by people like this New Jersey woman who told him, as a diabetic herself, she has extra to sell.
In a pharmacy, it's like more than 500.
On one level, it's understandable that people would look for other ways to find less expensive insulin.
But Dr. Robert Gabay with the Joslin Diabetes Center says the practice is not only illegal, it could have fatal consequences.
Who knows if it's insulin, but even if you know it's insulin, the sort of safety margin and dosage of insulin is pretty narrow.
It's ridiculous that it's becoming a black market item. In other countries, you can get insulin for $11, and it's the same companies that are selling it.
The competitive marketplace is working.
In an interview with CBS News last year, a spokesperson for the trade group that represents U.S. pharmaceutical manufacturers says the problem is not with the rising cost of the drug so much as with the patients' increasing insurance deductibles.
It's very upsetting that our government is allowing this. Somebody should care about us, the citizens.
Now, the Justice Department is now investigating these price hikes. The American Diabetes Association is also calling for Congress to hold hearings on affordable insulin access.